There is growing concern tonight about the Zika virus, a mosquito-borne infection with possible links to birth defects. The head of the World Health Organization says it's on a rampage. Here in the U.S., the Obama administration is trying to stay ahead of it. Correspondent Kevin Corke is at the White House tonight.
President Obama's concern about the potential spread of the Zika virus inside the U.S. is growing, so much so that this week he summoned his health and national security teams to the Situation Room to assess the ongoing fight against the virus.
We don't expect a major outbreak in the United States, despite the fact that there's considerable problems in South America,
including nearly 4,000 cases of Zika-linked birth defects reported in Brazil this year alone. That's about 30 times that country's annual rate since 2010. And according to the World Health Organization, it's, quote, spreading explosively. In fact, the WHO estimates 3 to 4 million people in the Americas could be exposed to the virus in the next 12 months. Already, 31 cases of Zika infections have been reported among U.S. citizens who traveled to affected areas.
The level of concern is high, as is the level of uncertainty. Questions abound. We need to get some answers quickly.
There are certainly reasons to be concerned about this disease, and I think that explains the federal response that's been mobilized here by the United States.
The Centers for Disease Control and Prevention reports the virus is spreading up to 23 countries and counting. And they're warning pregnant women against travel to several popular Latin American destinations like Mexico, Brazil, and Panama, and Caribbean hotspots like Barbados, Puerto Rico, and the U.S. Virgin Islands, just to name a few. And several major U.S. air carriers, including American, JetBlue, and United, are already offering refunds for those impacted, although restrictions can apply, and travelers are encouraged to call their carriers directly for details. Okay, so what's the big takeaway? Well, if you're pregnant or can become pregnant, obviously you want to exercise caution if you're traveling. However, if that does not apply to you, chances are even if you got the Zika virus, it would only result in flu-like symptoms. Those would likely be brief, and most people, by the way, Brett, won't even experience that. Back to you.
Kevin Corke, live on the North Lawn. Kevin, thank you.